50% of adults have some form of gum disease, and most don't even know it. Many patients...
Our nation can only be as strong as our health, and we're not doing well now. We have twice the chronic disease of Europe and 4 times that of Mexico, Japan, China, and India. 75% of our medical costs are caused by chronic disease by things that we can prevent. We know how to prevent 75% of chronic disease right now, but we don't do it. The gap between our knowledge, that technology, and our increase in medical costs grows, and because of that, we're now at a much worse point. Only if America stops the influx of chronic disease, only if each individual stops their own chronic disease, can we lead in healthcare, and can America be a vibrant country with a high standard of living.
To have true healthcare reform and not health financing reform, we really need to help people create health. The reason for the spiraling healthcare cost is not because of irresponsible insurance companies. The healthcare costs are rising because we've got a lot of unhealthy people. To cause a clot and block. I'm currently on the board of directors of the American Academy of Private Physicians, and through this organization, I've been introduced to many innovative technologies, many innovative testings that are going to really impact my patients' lives and implement into what I now consider a third era of medicine practice. The first era of medicine was the beginning of time. That was the era where our main focus as health providers didn't have a lot of tools at that time, was to battle infectious diseases. That's what killed people. So once we had improved public health, once we had antibiotics, once Elvis got his measles immunization in 1958, we transitioned to the second era. It's the era of combating chronic diseases. We started getting terrific heart surgeries, started to be able to identify and treat cancers. And throughout the last 50 years, the amount of technology, medicines, treatment options have been fabulous to, once we find the disease, and fix it. So the mindset of every physician in the country is finding the disease and fixing it. And the third era needs to be a new mindset among all health professions to participate to help our patients create health and have more good years. Within creation of health, we're helping to take a person who is not yet sick, has not developed a problem, and prevent them from ever going down the path to sustaining that illness. So what I like to do with my patients is I like to, during their office visit, in an effort to help them create health, I like to implement what I call a process called projection diagnostics. Projection diagnostics is simply trying to project their future health path by using diagnostic testing, technologies, blood test, urine test, that will help to show them their areas of rusting. So what I like to do is to show them their diagnostic results, project their future health path based on the results that we find. And typically, if a person's on a bad health path, they can see right in front of them where their sort of problems lie. So as I'm identifying patients with disease, I would have a subset of patients who I couldn't find a cause for the problem. Well, then when I discovered the amazingly strong association between mouth disease and the things that I do treat, like blood pressure, diabetes, heart attacks and strokes, even things like pneumonia, and a whole long list of systemic diseases that can originate from disease in our mouth, that was another turning point in my career. Once I looked inside the mouth, I found the source of a lot of problems in people who otherwise might not have had their problems identified.
The mouth. It is such an important part of the human body, yet often overlooked when we think about our overall health.
The mouth and the rest of the body relate anatomically and functionally, and that's why the oral systemic connection is absolutely inherent in the way we're put together. So the mouth shares the same communication systems with the rest of the body. But then the mouth itself has some key physiologic functions that make it essential for our health and well-being. We eat through our mouths, we breathe through our mouths, we protect ourselves through our mouths, we have sensation through our mouths, we have immunity through our mouths. So all of the basic body functions that keep us going on a day-to-day basis involve primary functions through the oral cavity.
It also plays a key role in our social interactions with people. I am horrified by a young person who has a bad smile, and I'm talking badly decayed, because they're never going to get that front row job. They're always going to be delegated to the back, and that's if they do get a job. So the mouth is a very important place.
In children's dental health, there is certainly a connection between what happens in their mouth and what happens in the rest of their bodies. So having a toothache is not just about your tooth. It affects the child's life. It affects how well they do in school. It affects how well they are able to eat, so it affects their nutrition, their growth, their development.
There's a connection. The body is connected. Whoever made this fantastic thing called the body was quite genius in that it is connected from head to toe.
From a disease standpoint, when we have different situations in the mouth, we respond, our body responds with inflammation, and that's where we start the inflammatory cascade that's affecting most of these inflammatory diseases. I want you to think about this. Inflammation, and there's a concept called inflammatory burden. When you get more inflammation in your system, the accumulation of that will have a tipping point where you tend to have inflammatory disease. Inflammatory diseases are heart attacks, strokes, diabetes, rheumatoid arthritis, various cancers, kidney disease, pancreatic cancer. The list goes on and on and on.
We're in a state of chronic inflammation, and that's the basis for every disease that everyone has. It's the basis for cardiovascular disease. It's the basis for cancer. When you're dealing with periodontal disease, there's this entire inflammatory cascade going on that people don't understand. When you get a cut, for example, okay, your body is set up to heal that cut, and that goes through a process of inflammatory response to solve the problem and resolve. If you always have a chronic inflammatory bacterial condition in your mouth, then you never turn off that process of inflammation. In other words, it never gets the opportunity to resolve and go away. There's just too much. The body can't react to all of them, and the body gets sick.
Periodontal disease, periodontitis, gum disease, whatever you call it, it all begins with bacteria. Bacteria are microscopic organisms, and in your mouth, there are billions. Over time, these bacteria can stick together and multiply over and over again. They can then form a colony and join together to create a thick layer called a plaque biofilm. Then, over a short period of time, it can dramatically spread throughout all of your mouth, teeth, gums, tongue, cheeks, everywhere. If there's an opening in your bloodstream in your mouth, the harmful bacteria can enter, causing the body many sicknesses. But there is another problem that occurs in response to the bacteria as your body tries to fight back. Inflammatory cells are triggered to try and kill the bacteria. But bacteria build their own strong defenses and battle back. This microscopic war ensues, and the result? Chronic inflammation. And inflammation is the basis for so many diseases.
The population of the planet is 7 billion. A nickel, the volume of a US nickel is a cc. A cc of spit has more bacteria than the population of Earth. It's got about 8 billion bacteria and a nickel's worth of saliva.
So bacteria is basically a foreign organism that comes into our body and attacks our body and causes disease.
The mouth is really a gateway to the overall health. And the bacteria in the mouth, they don't just stay in the mouth. So the microbiome, the flora, is actually very dynamic. It's mobile. Not only it's changing inside the mouth, but it can also move. It can go from the mouth, from oral cavity to elsewhere in the body.
We say to the dental patient, you have an infection in your gums. The total area of your gums is about the size of the palm of your hand. If you looked at the palm of your hand and you saw an open wound the size of the palm of your hand, would you just decide not to do anything about it? And yet people are choosing every day not to address the infection in their mouths. People think that it's normal that when they brush their teeth, their gums bleed. And I don't know where they came up with that.
If there's a little blood in the sink, it means they've got a problem. The bacteria that cause inflammation in the mouth will typically cause inflammation in the rest of the body. Yet if there's a little inflammation between the teeth, it means that there's a problem where those high-risk bacteria may be getting into their bloodstream and cause any one of the many systemic diseases that can originate from bacteria in the mouth.
I'd like to stand back and realize that there's some untreated inflammation here and look at the root cause. And
10 years ago, I found a gentleman by the name of Dr. Bradley Bale who was doing family practice in Spokane, but had been kind of taking a special focus on disease, vascular disease, versus just general family practice. So we joined forces at that point. I worked with him in family practice, and then in about 2001, 2002, we decided to close the family practice and spend 100% of our efforts on vascular health. And the reason we did that is because so many people are told they are fine based on their risk factor profile, based on their age, their gender, and all of those risks, and they are harboring silent vascular disease. And the reality is, it's the vascular disease coupled with inflammation that really causes events. And that's really where the Bale-Donine method got going and started, is that we are doing something different. Rather than focusing on a risk factor paradigm, we're focused on a disease treatment paradigm. And the differences between those two modalities of practicing medicine are pretty grand. A disease treatment paradigm looks at an individual for the presence or absence of vascular disease. What causes an ischemic event like a heart attack or a stroke is when someone harbors silent plaque in the artery wall, and an inflammatory process allows that plaque to rupture through the wall of the artery. So prior to that rupture, nobody would feel plaque because it's not in the hole that blocks blood flow, it's in the wall of the artery. Once the body allows that plaque to rupture, an autoimmune response is to say, hey, we better heal that injury. No different than if you cut your hand, you're going to form a scab on it. Well, what happens inside an artery is that you get that plaque rupture, and the body automatically sends in a clotting cascade to heal that cut or rupture of the artery wall. Well, then a blood clot is formed that is inside the artery, inside the opening. So that blood clot, if it migrates and blocks blood flow in the heart, we call it a heart attack. If it lands in the brain, we call it a stroke. But at the end of the day, it's a blood clot that blocks the flow of blood.
How was your last dental checkup?
When patients come in, sometimes they're surprised when I really dig deep into their oral health, and I talk to them about what their dentist says when they come in. I ask them if they floss, and if they don't, I ask why. And it's a great conversation to have because it allows me to demonstrate that the oral cavity has systemic impact.
We've always had a keen interest in the health of the mouth in our work to prevent heart attacks and strokes, and that is just intensified as the science has evolved. We now have great science telling us that the cause of arterial disease is inflammation, and another source of arterial inflammation is infection in the mouth. The American Heart Association's previous conclusion that periodontal disease has level A evidence showing it's independently associated with cardiovascular disease. And independently associated is hard to achieve. That means you've adjusted for how old you are, how far you went in school, how much education you've had, what's your cholesterol, what's your blood pressure, what's your BMI, how much do you weigh, do you have diabetes, what about, et cetera, et cetera. So when you try to get independent association, most everything falls by the wayside. And it's like, well, there's an association, but after you adjust for this or this, it kind of disappears. Not so for periodontal disease and cardiovascular disease. And level A evidence is the highest quality evidence you can have. With the most recent study coming out, it actually implies up to 50% or more of acute heart attacks are triggered by oral infection. That's huge. Heart attacks are the #1 killer in this country. Strokes are the #1 cause of disability. The current cost of cardiovascular disease to our healthcare system is about $518 billion. And it's all preventable. And about 4 years ago, we felt our method, which we call the Bale-Donine method, had evolved to a point where we could actually guarantee our work. So that means the patients that I personally treat, if they were to suffer a heart attack or an ischemic stroke, the fees they paid to me for my service that year I would refund. So we get extremely high-risk patients, which is fine. I like a challenging patient, and I do believe you can shut down the disease process in anybody.
Julie is a patient of mine that I met, unfortunately, after she had a heart attack. She actually had 2 heart attacks, believe it or not, at the age of 37.
I was getting ready for work one morning and probably running a little later than I wanted to. So I was getting ready, and I remember feeling rushed or being rushed, but the feeling was all in here, and then it just kept compounding. And this heaviness, I wasn't breathing deep, a heaviness was just resting on my chest, and I couldn't make it go away, and I couldn't feel better.
Julie went in with chest discomfort. They told her she had pneumonia. And she said, well, I don't even have a cough. How could I have pneumonia? And they said, well, take this antibiotic and let us know how you feel in a few days. So the next day, same thing, the chest pressure is worse. So she goes in, and this was just last year. This isn't in 1957. This is in 2012 in a metropolitan city. She goes in again, and it wasn't till her second visit that they finally determined that indeed this poor 37-year-old mother of a 3-year-old daughter is having a heart attack. So she's treated now for her vascular disease, but when she first came in to see me, the tears and the issue were not because of pain, it was because of fear. She had no idea why on earth she had a heart attack. Why would she? She's a beautiful, fit, healthy 37-year-old mother of a toddler that says she's been told she's healthy her whole entire life. Why on earth did she have a heart attack? And so with the knowledge that we have of what causes vascular disease, it was with that education and that knowledge that Julie finally understands what caused her vascular disease, and we're treating that, and we're measuring the inflammation to know that our treatment is working, so she can proceed with life in confidence to know that that won't happen again. Most recently, however, I was doing Julie's inflammatory labs, and all of a sudden I saw a spike. Some inflammatory labs can be thrown off if you stub your toe, if you have a sore throat. This one really means something. It's a player in the disease state. So when this lab value is elevated, it tells me objectively that something is starting to tread on our territory of vascular stability. So that's when I pulled Julie in the office and I said, gosh, do you have anything inflammatory going on?
She said, this inflammation has got to be coming from somewhere. What is going on inside of you? She said, are you sick? Did you sprain an ankle? Anything? And I said, no, nothing. And she said, do you have a tooth that's bothering you? And I said, yes. Yes, I do.
And I said, well, let's investigate that further. Let's go back to your dentist and let me call your dentist. So that's indeed what I did, and we talked, and I said, this inflammation is being driven by something other than the common vascular risk factors that I'm treating for Julie. Can you please look a little deeper into that tooth that's been bugging her? Sent her to an endodontist who ended up doing a root canal, and it was found out that that tooth was horribly infected. Now the root canal has been treated, she's got the infection eradicated, and then doing her repeat inflammatory labs, I can now see that the inflammation is now mitigated, and onward we go. But it was really that tooth infection that really drove her vascular risk. And for someone like Julie, who had a heart attack unknowingly, we want to make sure that we just erase any chance of any vascular inflammation, including the oral systemic connection.
The total estimated cost of diagnosed diabetes in the U.S. in 2012 was $245 billion. Medical expenditures for people with diabetes are about 2.3 times higher than for people who don't have the disease, due largely to the complications of the disease, whereby a decrease in the immune system's ability to fight off infections leads to its complications. Periodontal disease is one of those infections which can adversely affect the diabetic patient.
Inflammation sets up a reaction that causes things in our body that makes us less responsive to insulin, which is how we develop type 2 diabetes. So whether it is inflammation from just a fat belly, or whether it's inflammation from gum disease, or whether it's inflammation because you've got a chronic abscess someplace, it causes the same process of a resistance to insulin, which leads to type 2 diabetes, or is the hallmark of type 2 diabetes.
Your blood sugar will not go down if you have an active periodontal infection, because when you have an infection of any kind in your body, it stimulates your liver to release sugar because your body wants to fight off that infection, and it needs that sugar to go into the cells of your body to give your cells the energy that it needs to fight off that infection. The problem is that when you get that blood sugar released into your bloodstream, it can't get to where it needs to go. We don't have the transport mechanism, the insulin, to bring it into the cells. And so the problem never goes away, okay? It can't fight off the infection. So diabetic patients understand that they'll say to me, I can't fight off infection very well. And they're exactly right. Their bodies do not fight off infection. That's why they have wounds, and that's why they have a lot of chronic conditions. The other thing is that sugar is just what bacteria feeds off of. Okay, so if you have an infection in your mouth and you have high blood sugar in your system, you're giving that infection exactly what it needs to grow. So it's a catch-22, and it's not going to go away.
We carried out a study where we asked the question, which comes first, diabetes or periodontal disease? So we took a group of individuals who did not have either disease, periodontal disease or diabetes, and we followed them for years. And this is one such case. This is a 35-year-old female with neither periodontal disease or diabetes. She was a happy young woman, and everything was just fine in her life. And then, about 3.5 years later, she developed very severe periodontal disease. And you can see the loss of bone in this area and upper teeth. So much bone is lost that the teeth have actually migrated. Some of the back teeth have so much bone loss that they're about ready to fall out. And this is what she looked like clinically at the time of the second visit. You can see the teeth have spaced. There's actually, there are abscesses, which are gum boils, which hurt. What we found is that in the time between the two visits, she also developed diabetes. And periodontal disease will actually lead to, be one of the factors in the initiation of diabetes. Now, there is another facet of the relationship between periodontal disease and diabetes, and that is if a patient has diabetes and also has periodontal disease, the periodontal disease makes diabetes worse. So it's a wonderful example of the interaction between the mouth and the body in both directions.
Surprisingly, the U.S. ranks 6th among the top 10 countries for premature births, with 1 in every 9 babies, or 500,000 babies, born prematurely annually in the United States. Pregnant women with periodontal disease are 7 times more likely to go into preterm labor. Maintaining a healthy mouth during pregnancy plays a critical role in the prevention of preterm birth and its serious consequences.
Being a researcher at the dental school, my focus is on oral microbiology. So how oral bacteria cause infections in the mouth and elsewhere in the body. In 1996, a study was published and provided the first evidence that women with periodontitis has a tendency to deliver premature and low birth weight babies. So since then, there have been a lot of epidemiological studies to link periodontal disease with adverse pregnancy outcome. Even these mild periodontal infections, when it occurs in combination with some other secondary infection, could cause severe adverse outcomes. And for periodontal disease, it tends to be ignored because it doesn't kill. But I think what we're showing here is periodontal disease does kill, because if the bacteria gets into the blood circulation and gets to the uterus, it could kill the baby. The findings from my lab and from my colleagues' labs, I think, could be potentially challenging the paradigm, because when you find an intrauterine infection, it's usually believed they originate from the vaginal tract. But we're showing with increasing numbers that a significant portion actually do not come from the vaginal tract, but they could come from the oral origin. So based on what we have seen, oral bacteria could account anywhere between 10 to 30% of these intrauterine infections. So it is a very significant cost. Not just financially, but it's also very emotionally, because if a family loses a baby, it's detrimental. People are very hurt, and they're hurt for a long time. And so they want, the question I'm always asked is, what did I do wrong? What can I do to prevent this from happening to my family again? So I think that's the big question that we want to answer.
In addition to causing birth complications, research studies have shown that women who have gum inflammation and infection and are undergoing infertility treatment have delayed results. It's much more difficult for them to get pregnant. This has been attributed to the extra hormones they are being given, which are being absorbed into the estrogen receptors we have in our gums. And in the presence of plaque germs in the mom's mouth, they cause inflammation, bleeding gums, and infection. But it stands to reason, whether a woman is taking infertility drugs or not, if she has bleeding gums, infection, or even if she just has high levels of bacteria in the mouth, then the body is going to be in a state of poor health, and pregnancy might not be possible. In American hospitals alone, the Centers for Disease Control estimates that hospital-acquired infections, an infection you didn't have when you came into the hospital but got while you were there, account for an estimated 1.7 million infections and 99,000 associated deaths each year. And for some of those who survive the infection, their lives are changed forever.
I'm an advocate for patient safety, and I have a passion about it. They call it obsession where I work, but it's just a passion because I love to protect my patients. That's what I do. One lady told me, I asked her if she had periodontal disease, and she said yes, she knew she had it, but that it expensive to treat. She didn't have dental insurance. And she was having a total knee put in. So she had her total knee. She went home. A few months later, she got infected. They had to take her knee out, and then she had to live without a knee for a while. And then they put a new knee back in. It got infected. They took it out. And when I was her nurse, 2 years later, I was her nurse, they were amputating her leg. And she didn't know anything about about periodontal disease, but she had an infection. And when she went into surgery, her husband told me that the cost of their medical bill for the past 2 years was $2 million.
They now tell us that half of America has a condition known as periodontal disease, which is more significant and more severe than gingivitis, which people get from time to time. But half of the people, what it says to me is half the people that now go into surgery have this condition. There are a couple of ways that this is a problem. In surgery, it's not that the bacteria from the patient's mouth is going to end up in, say, like a knee surgery. It's that the body can only fight infection on so many fronts. And it's like a war. It has a certain amount of resources it can allocate to that fight. And when you have an infection elsewhere in your body, it's allocated resources to that infection site. And then when you go in and do a surgery, you create another wound, and that wound demands that the body put attention to it too. So the reason you don't do surgeries on patients who have infections is because it diminishes their ability to recover from the surgery and increases the likelihood that any other bacteria could then take hold because there just aren't enough antibodies to fight that infection. From a financial point alone, if you look at the cost of a standard post-operative infection, it's between $15,000 and $30,000 per incident. And that's a cost that's generally borne by the hospital itself. But if you really want to know the truth about what we're being able to do, when you look at the long-term care industry, 90% of those patients have an oral infection. 90%. And when you think about that, and you realize these patients have a lot of other conditions. They have heart disease, they have diabetes, they have ulcers, they have pressure wounds. All of these are made bad or worse by this periodontal condition. The real good news is that there are easy, non-surgical ways of correcting the condition that you can get from your local dentist.
It's clear to see that the inflammatory burden caused by periodontal disease is a serious problem. But the mouth is also the home of many other preventable chronic diseases that plague our society, some of which goes untreated and undiagnosed for years.
I would be able to, be drowsy because without a good night's sleep, it just like I could be driving like this, I'd be okay, and then get to a stoplight and waiting for the stoplight to turn. My eyes just get real heavy, and I'd be like just sitting there stopped, and then the car behind me would be honking and be like, "Oh, the lights changed. It's time to go." About 2 years ago, my life was much different than it is today. I was not sleeping well at night, and it was starting to affect other parts of my life. I was at work, and I dozed off between telephone calls, and I did get in trouble for snoring at work. I was probably in about the worst condition of my life, being obese and with the untreated sleep apnea. At the highest point, I was about 285 pounds. But yeah, that's probably me, about 75 pounds heavier than today. I was wearing 42s and pants, It was like having a ball and chains or a weight strapped to me that I was just having to carry with me every day. I went and saw Dr. Jeffrey Lowe. I was just in there to do routine cleaning, and they were talking about how I slept. One of the questions was when you're having a conversation, much like what we are now, and that was one that would be, something that could be likely for me to feel drowsy or doze off. And I said, yeah, I've done all of these things.
So we had him take the home sleep monitor home, and he took the test, found out he had severe apnea. Nothing we can help him with here, not with appliances that we can create, but we did refer him to the hospital, who, after many phone calls, found the sleep physician that could help him, and they got him on a CPAP.
My AHI was over 100, which essentially AHI just means how many times you stop breathing during an hour.
And he swears we saved his life. He's lost weight, started to exercise. He just could not feel better because he went to bed rested and woke up tired instead of going to bed tired and waking up rested. So he couldn't even fight his day.
It's nice to know I can be a functioning person of society and not have, other complications or not feel tired. That's the big thing, is just to have energy throughout the day. I started becoming more physically active, and then I bought a bicycle. And now I ride the bicycle almost every day. New Bob is definitely different. For one thing, all of the questions, how likely I am to fall asleep, and all of those conditions, it's always a never now. So I get to check never. I've dropped at least 10 inches just in my waist size. In fact, the weight was coming off so fast at first. It was like every couple months I had to go and buy new clothes again. I feel like the way that the dentist views complete health, instead of just looking at me as a mouth, but as thinking of me as a person, has been instrumental in my transformation.
And I think that's what's missing, is just a conversation. The fear that, well, if I talk to him about sleep apnea, he might go someplace else and never come back to this practice. We don't have that fear. We have the, what if he doesn't get his sleep apnea treated? What if he doesn't make it to 50? What if he ends up with high blood pressure and is eating 4 different types of medicines? What if it could be easily just treated by letting the guy get some air while he sleeps? Because that's what's happening every day in this practice.
The mouth is also home to one of the biggest killers in our country, oral cancer. Every 60 minutes, one person dies from oral cancer. That is one person every hour, 24 hours a day. Sadly, it affects people of all ages, nationalities, and walks of life.
My first appointment here was September 29th of 2008. That is when I was given my diagnosis. It'll be 5 years in September.
Denise is one of, unfortunately, a typical story. A typical story in the sense that here is a patient that's been pretty healthy and doing well, and has some growth in the mouth, and typically by the time it is recognized as an advanced stage.
It all began in July of 2008. I had a broken tooth, and I went to my regular dentist, and he said, I need $13,000 in dental work. I have an abscess. He gave me an antibiotic, and that was it. And I told him I don't have the $13,000 to do the dental work right now. I couldn't worry about it. I was a single mom raising my 2 children. I went through a horrific divorce just 2 years prior to my diagnosis. So I let it go. About 2 months later, I broke another tooth. So I went over there to go see Dr. Israel, and he looked, real quick, and he said, "Oh, this is terrible. We need to do a biopsy and a 3D CAT scan immediately. You have a growth in there."
She already presented with what's called a stage 4 disease, meaning that the tumor had grown substantially, not only in size, but also had metastasized or gone to the lymph nodes in her neck.
The left side of my face was so normal, you can make out where my teeth were, my cheekbone, my jawbone, my gums, everything. My right side was a black hole, basically. It was all black. So my option was to go home and not do anything and only have a few months to live, or opt for surgery, chemo, or radiation, and hope that it worked. So I said to him, "No, let's do it. We need to do it. I have 2 children at home. If I don't make it, they're going to be without a parent, because I am the only parent that they had." And I was determined not to let it win. I was determined to beat it, because I had to be here for them.
We discussed the plan with her and her family. She accepted the plan, and then we embarked on the treatment. And the treatment for her was, doing the surgery, which was called a maxillectomy. That means removing the tumor from her maxilla with the upper jaw. Fortunately for her, we were able to save her eye, which was an important thing. And then we at the same time did it's called a neck dissection, meaning removing the lymph nodes from her neck. And at the same time, we transplanted the fibula, which is her leg bone, and made her a new upper jaw.
When my doctor did the surgery on my face was swollen, but you couldn't tell what he did to me. And then chemo radiation started, and radiation deteriorated everything that he did. So what you see now that is destroyed is due to radiation. So since 2009, after chemo radiation was over, they have been trying to reconstruct my face because of what radiation did.
Is this a kitty-sized bed?
Seriously.
Is this like the furthest your feet have ever gone to the bottom?
After all these years, I'm still not finished, but almost done. Yay. And I'm here, that's all that matters, but nobody caught it in the beginning. So if it was caught originally, it might have never turned to stage 4. I might still not be battling what I'm battling now. There is a way to detect oral cancer in a dentist office immediately when you go for your cleaning and checkup every year. All they have to do is screen you for it. It takes a minute for them to do it. Between what my insurance has paid, donations have paid, anonymous donor has paid, I have to be at least up to $4.5 million in medical. It's early detection, preventative health care, and all the money that was spent on 17 operations could have been prevented. You're never going to get rid of me, even when I'm better. I'm never leaving.
That's a good problem to have.
I'm never leaving.
Denise is very energetic and very engaged and committed to life.
There's one of the 2 of them.
The other thing that also I think is very important about Denise is her family life. She is adored by her kids, her mom, and they're always there. Clearly, there's a very tight-knit family.
There's no way that we can go about our daily lives without her. She's such a huge part of it that it wasn't an option for her to not be here. So whatever it took, we were all going to get through it together. Okay.
I love you guys too.
healthcare, we are twice as expensive as Europe, 4 times as expensive as Mexico, Japan, India, and China. We've got to be competitive in medical costs. That's where major companies have figured this out. And they're putting in incentive programs and wellness programs in a greater degree to encourage preventive care. We have hit an inflection point in our total cost that we have to get less expensive. And the only way we can get less expensive, or the only 2 ways, are rationing or getting rational and taking care of ourselves. If we can do that, and in fact take care of our teeth, we're going to be in much better shape.
A recent study by United Concordia, the largest of its kind, looked at the health of over 1.7 million people and found that almost 200,000 had both chronic conditions and gum disease. Then they looked at those within that group who were treated for their gum disease and those who weren't. The financial savings annually by those treated were impressive. Diabetic patients treated for their periodontal disease, $3,291. Patients with heart disease treated for their periodontal disease, $2,956. Stroke patients treated for their periodontal disease saved $1,029. Patients with rheumatoid arthritis treated for their periodontal disease, $3,964. And pregnant patients treated for their periodontal disease saved on average $2,430. All this simply by getting a healthier mouth.
So just to go over what we're going to do today.
For the mouths of America to get healthier, there is a specially trained group of men and women in this country who will have to step forward and provide preventive care.
Is we're going to get you healthy.
Some refer to them as oral medicine specialists. We know them as the dentist. Not exactly the first person who comes to mind when thinking of solving our nation's health problems, but if you think about it, dentists are in the perfect position to make a tremendous impact on our healthcare system. Traditionally, the general public is already in the habit of visiting the dentist every 6 months, way more often than the average American visits their primary care physician. In addition, it's already been proven that prevention is significantly less costly than trying to cure people, and so considering the 162 diseases that can be detected in the mouth, dentists are the ideal provider to watch and care for individuals. In essence, the system is already set up for the solution.
Okay, so brush your teeth, floss.
But if this is the case, why then are things not working like they should? It's simple. There has to be a contextual shift in how we think about the mouth in dentistry.
In working with dentists for the past 19 years, I've really learned something profound and had a profound awareness. I was watching the movie Hangover, and in the movie Hangover, the guy walks up and he says, I'm a doctor, I'm Dr. Stu, and he goes, his friend says, you're not a doctor, you're a dentist, you know? And at that moment, I realized at that moment, something really needed to change, and there needed to be a person that stood up for and advocated for the dental community. The source of what has to shift in dentists is that they're trained to find the chief complaint and fix it. That's a reactive care dentist. They walk into a room and they ask the patient, is anything bothering you? Is there anything wrong? Now the dentist is looking through a wider scope, a wider viewfinder, and now being a screener, looking at a wider context of treating the whole person versus just the mouth. And we're not saying dentists are gonna replace medicine. No, they're now partners with, and they are the first line of defense because the mouth is that first indicator. And check this out, 9 out of 10 patients who go to a dental office do not have a primary care physician on their medical history form.
The dentist, the hygienist are critical to maintain vascular health and wellness. It can't be done alone. And then from the other side, the dentists and the hygienists need to realize that their work has systemic merit. So both communities, medical and dental, need to start talking.
Dentists and the physicians both need to be aware of this connection, and both sides need to come together and to provide integrated care to the patients.
Well, there are a variety of gaps that sit between health and health care, that sit between access to care and utilization of care, that sit between medicine and dentistry. And there's, in general, for our purposes, a lack of appreciation of the import of the oral cavity for the rest of the body. So if we want to see diabetics stay healthy, if we want to see pregnant women do well in their pregnancy, if we want to see people sustain good health, we can't afford to have some significant aspect of our body with chronic infection or chronic problems.
I feel so strongly that dentists could be a part of that preventative care. They're changing the model in how they're paying physicians, and physicians could only help to benefit from adding dentists to their team and adding hygienists to their team, because we look at things in a preventative mode.
People are impressed by that type of dental care. And as physicians, we need their help. Because there are a lot of people out there, they won't see a physician in a year. Most patients will see a dentist at least once or twice a year. So their exposure to these people is higher than ours. And they all need to be educated on this, because it's not just the physicians who don't recognize this link. Believe it or not, there's some dentists, I think, who still don't believe it, or they're not on board with it. That's got to stop.
The public, government, insurance, caregivers, and even dentists themselves have to begin to think of dentistry as part of the first line of defense against disease and sickness.
So today we went through the Healthy Mouth baseline. Oral cancer screening was negative today. Everything looked good.
It's now happening within a movement called Complete Health Dentistry,
Blood pressure was 110 over
where the
82.
dentist is no longer looking at patients as just the mouth, but looking at the complete health for each individual. Dr. James Lisinski of Buffalo, New York, is one of many dentists who are making the shift from traditional dentistry to complete health dentistry.
When we graduated as dentists, we were taught to be problem fixers. But now, with this new context, the body affects the mouth affects the body, has allowed us to look at the whole patient and see exactly, what's going on. We found when we started asking people about their general medical history and their family history, we found that a lot of them hadn't been to see their physician for a checkup in years. So we can engage conversations with them about everything from smoking to weight to exercise to getting that appointment with their primary care physician so they can get that physical checkup. What we're doing is we're not treating their high blood pressure when we take their blood pressure, but if we see that they have any of the signs and symptoms of that, we're then encouraging them to get to their physician and have it treated. We have multiple ways of searching for oral cancers. Digital x-rays, we have digital panorexes, digital periapical x-rays. We also still use visualization, palpation, the tactile feeling of the lymph nodes of the patient. So we try to do the best we can, finding any growth at its smallest stage. In Complete Health Dentistry, we also have what's called the Healthy Mouth Baseline. It's a tool to help us educate the patient what we're looking for. A lot of times patients are sitting in the chair and they don't know what we're doing. We're able to show the patient, this is what we're looking for. This is what is healthy. This is what is disease. There's no one person that's going to slay this dragon. I mean, these chronic diseases cannot be solved by one person. We, as a community of healthcare providers, need to work together as a team so that we can get the solution to keep those people that want to be well, keep them well.
At my previous dentist, I just thought that was normal for a dentist's office to just do the basics. And then I came here and they took my blood pressure and asked family history. They checked me for oral cancer. I just feel like a lot more of an important patient here.
Bring it up.
Ready? What's our thing? Dentistry from the heart.
The Complete Health Dentistry model also involves giving back to the community. And that's a way of caring for the community because, as I've said before, we're not just interested in the patient, but we're interested in the patient, the patient's family, and the community that the patient lives in. And so by doing community events and charity events, we're taking care of the community. It's exciting to come to work on Monday morning, it really is.
Kevin's gonna take blue.
Dentists are no longer seen as takers. That old model's being broken up by the generosity of these men and women, by the care, by the contribution that they're making, not only to patients, but their communities as well.
Got here at what time?
2 o'clock.
2 o'clock. Is that in the afternoon?
Morning.
Morning. All right. Well, that's fantastic. Well, we're glad that you're here.
The distinction between the standard dentist and a complete health dentist is extremely important. The standard dentist does a good job of taking care of teeth in the mouth, but a complete health dentist focuses not only on care of teeth and the mouth, but also cares for the complete health of the individual. By taking this new approach to their profession, hundreds of dentistries and dental schools across the country are joining the complete health dentistry movement.
The Arizona School of Dentistry and Oral Health is very unique. One of our mantras here is that it's not about the tooth, it's about the person attached to the tooth, the family attached to the person, and ultimately the community attached to the family. We want to produce doctors that are leaders in communities and along the way teach them to be great doctors that are engaged with that community.
In an effort to get the message out to the public, we pull people together who have things like high blood pressure, cholesterol, diabetes, and who really want to get healthy, but who haven't been to the dentist in quite some time. And we're going to spend the next 6 weeks to 3 months getting their mouths healthy and see if that has a positive effect on their blood pressure, their cholesterol, their blood sugar.
I'm just thankful to really try to get my mouth healthy for sure. I didn't realize how important it was.
For the first time, we're going to work with United Healthcare to get their patients, medical patients who are age 0 to 5, who have already gone to a physician but have not gone to a dentist. We will go and talk to them and reach them at their homes.
What do you think of the dentist?
It helps you a lot.
We've gotten involved with the hospital so we can have a referral program to physicians, and physicians can refer back to us then as far as what we need to do on this end with the mouth.
Our mission is by 2020 to actually have Northwest Kansas be the healthiest region in the United States.
I know we're going to make some vast changes in people's lives for the better. We're going to save a lot of lives. We're going to improve a lot of health. We're going to save a lot of healthcare costs. And I have no doubt that the world will be a better place because of all the work all of these passionate individuals are doing.
There doesn't have to be any one hero. There just has to be a whole lot of heroes working together.
One of the keys in everyone getting healthy is decreasing inflammation. And the most powerful thing we know about decreasing inflammation is taking care of your gums. And dentistry has a key role in that.